Over the last 24 hours, we would have done about 222 COVID-19 tests. And of these tests, we found 2 persons who were positive. We currently have 2 persons in Ocean View, the hospital. None of them are in the ICU, so that's a good sign. And right now we're monitoring 68 persons who would have tested positive for COVID. So far, we have administered 447,135 first doses for adults. That's about 87.2% of our adult population. Second dose, right now we are 347,020 doses. That's about 67.6% of our adult population. In terms of persons ages 12 to 17, we have administered 35,817 doses, or approximately 49.1% of that age cohort. Second dose for that age cohort is 26,296 doses, or approximately 36.1% of that group. Then for the 5 to 11 age group, we have administered 8,701 doses. That's 8.5% of that age group, first dose. And second dose is approximately 4,713, or 4.6% of that age group. Booster doses, we are right now at 74,541 doses. So yes, we have a lot of capacity at the Ocean View Hospital. In fact, we have 198 beds with a 52-bed ICU. So what we have been doing is that in addition to COVID-19 patients, from time to time we also have pregnant women with COVID-19, so we are able to hospitalize them there. And we have all the arrangements there for them to give birth at that facility. In addition to that, there are persons with other infectious diseases such as TB. So we are able to hospitalize them there as well. So these are patients without COVID, but they might have other transmissible infections. So we can admit them to that hospital. And more recently, with our monkeypox cases, the 2 cases we had, we were able to isolate them in that facility. So I think the role of the facility would evolve over the next coming months. We have to wait and see, however, with newer variants and so forth, whether we'll have increased hospitalization. But for now, we have, in addition to COVID, been using the facility for other infectious diseases. Well, you know, the COVID-19 has been constantly evolving, and we're right now at Omicron in the Greek alphabet. But more recently, they have seen, and with Omicron, you have several subvariants. So you have BA1, BA2, BA3, BA4, BA5. We have seen some mutations, and newer variants are emerging. Some of them, they have what is called immune escape, meaning that even if you had vaccines, or if you were previously infected, the antibodies that is produced by your immune system would not be adequate to fight these types of variants, so you can still get infected. This includes one that is called BA2.75.2. So this one is emerging. It's not widespread as yet, and the researchers are still watching to see whether this would become dominant. But it's early days yet, so we don't know what would happen. In this instance, because you have the virus that is constantly mutating, and with those mutations, people can get sick. So, in several countries right now, while people's behavior has been one that they don't want to take vaccines, they're not wearing masks, and so forth, people are still getting sick. People are still dying. So, while globally there have been a decrease in cases, that decrease might be because people are not testing. That's one. We have seen a decline in deaths, and that's because the forms that are circulating right now might be milder. And therefore, you're not getting so much hospitalization and deaths. But again, we have to be vigilant because there are new variants that are emerging. So it's hard to say when you can declare the pandemic over, because you have to be mindful of these new things that are happening. In some parts of the world, the researchers are predicting that you'll start seeing a surge as some of the temperate countries go into winter, that you will start seeing a surge in cases. But we'll have to wait and see.